7:43, we are back. We're talking about the vending machine debacle here during the break. Crazy stuff. Okay, Yvette Lu is here. Good to see you.
Likewise.
We're planning, look outside, we're planning for tropical vacations in 2017, and the big thing and reminders we want to be aware of. So vaccinations front and center. What do we need to be aware of?
It's really important to think about travel health before you go on your trip, because there are vaccinations that you need to get for many tropical and more sort of less developed countries. So you need to think about this quite far in advance. You want to see your doctor or the travel clinic at least 6 to 8 weeks beforehand, because these vaccines take time to take effect.
And with these vaccinations, and I was asking you this in the green room, if you get that yellow card in that list of vaccinations, what happens if you lose that? Because sometimes you could take a trip 5 years later, think, has it worn off? Do I need to update the vaccinations? How does that work?
If you lose the card, your doctor most likely will have a record of all the vaccinations, so you can go back to them and get a record of the vaccinations. Also, many of the vaccines do need to be repeated after a certain number of years. So first we should start with like the basic vaccinations that everyone should have, like the childhood ones: measles, mumps, rubella, tetanus, and diphtheria, which needs to be repeated every 10 years, the yearly influenza vaccine, things like the pneumonia vaccine, meningitis, chickenpox, shingles, HPV vaccine. So those are all vaccines that you should be talking to your doctor about normally. There's also the hepatitis A and B vaccine, which I recommend for everyone who's traveling, but I also recommend for people who live here, because sometimes you do get hepatitis A outbreaks. In British Columbia, hepatitis is an infection of the liver, and it can cause liver failure and liver cancer. So these are vaccines that you should be getting even though you live here. And then if you travel, particularly, as I said, to tropical countries and less developed countries, there are other vaccines like, for example, yellow fever vaccine. A lot of countries require that. Typhoid vaccine, cholera vaccine, and meningitis vaccine in Africa. And then if you're going to do adventurous activity like caving or going into the jungle, then you might want to think about getting the rabies vaccine. And if you're going to Asia, the Japanese encephalitis vaccine. So you can see there's a lot of vaccinations that you have to think about.
The homework has to be done beforehand. Say
Yes.
a simple trip if you want to plan to go down to Mexico, the idea of Zika virus and things you need to be aware of for timing, especially if pregnancy is a priority.
Yes, so there are some mosquito-borne infections. Zika virus is one of them. Malaria is another one. So malaria is really important to know about, because it can be a very serious illness. It can cause death. And if you're going to an area that has malaria, it's important to consider as to whether or not you need to take malaria prophylaxis, which is a pill that you take once a day or once a week, and that prevents the malaria from taking hold in your body. Zika virus is another mosquito-borne illness, and that one we've heard a lot about in the media, mainly because if you're pregnant and you become infected with the Zika virus, there's a chance that your child may have birth defects. So there is a waiting period for people who want to get pregnant. If you're thinking of conceiving, you should wait 8 weeks if you're a woman and 6 months if you're a man after exposure or after travel to a Zika-affected area. Because the Zika virus, sometimes people don't experience any symptoms, so even if you haven't had any symptoms and you've traveled to the area, you should still observe that waiting period.
Even if you're taking the precaution with mosquito repellent and things of that nature, still
well, if you haven't had any mosquito bites at all and you're absolutely sure, then maybe you don't need to, but like, to be safe, I think it's probably better just to observe that, because you might have a mosquito bite that you don't know about that you haven't observed.
Fair enough.
Yeah.
Always tried and true. The traveler's diarrhea, prevention, medication, and things preventative. What do you recommend?
So traveler's diarrhea is probably one of the most common travel-related illnesses that people get. There is a vaccination, but there's some question as to whether or not that vaccination is effective or how effective it is. So some people may choose to get that vaccine, which is an oral vaccine. Otherwise, if you just want to be careful about what you're doing, you can do hand washing precautions. Don't drink the water. Make sure you don't eat raw food, or if you eat fruits, then make sure you peel the fruits. And then what some people do is they take a course of antibiotics with them so that they have it on hand if they do have severe traveler's diarrhea. If it's mild, you can just rehydrate and do symptom management, but if it's more severe, like multiple episodes, bloody diarrhea or fever, then you really should see a doctor or take the antibiotics that you bring with you.
So a lot of homework to cover out before we go. Any great resources, websites you recommend for doing that?
I always look up the country I'm going to or the country that my patients are going to on the CDC website. They have an excellent travel website. Health Canada also has a website. It's good to look at these websites to look for travel alerts before you go. As well, there's a service that the government provides called Registration for Canadians Abroad, and you can sign up and register your trip there, especially if you're going on a longer trip. It's probably worthwhile. And then I recommend people get travel insurance, because you never know what will happen.
Excellent tips right there. You saw those websites on screen to cover you off. Yvette, thanks so much for coming on.
Thank you.
And